Weight loss medicines. Medication may be helpful for weight loss when used in combination with diet, exercise, and lifestyle changes. However, it is important to understand the risks, benefits, and limitations of these medicines. They can cause side effects that may be bothersome, and in many cases the long-term safety data are limited. In addition, these medicines may not be covered by insurance and can be expensive. Although weight loss medicines may not help you reach your dream weight, they can contribute to reducing your risk of diabetes or heart disease. Weight loss medicines may be recommended for people who have not been able to lose weight with diet. Incretin-based therapies. These include dual-acting glucagon-like peptide-1 GLP-1 and glucose-dependent insulinotropic polypeptide GIP receptor agonists. GLP-1 receptor agonists. GLP-1 and GIP are both hormones called incretins for this reason. These medications are also known as incretin-based therapies. They work by increasing insulin release in response to a meal when blood sugar is high, slowing digestion and making people feel full more quickly. Incretin-based therapies were initially approved for the treatment of type 2 diabetes, but some of these medications can also help with weight loss. Only some of the medications in these categories are approved for treating weight loss in people without diabetes. They are given by injection under the skin in the abdomen, thigh, or upper arm. These medications can cause gastrointestinal side effects such as nausea, vomiting, diarrhea, and constipation. These medications should not be taken during pregnancy or if you have a history of pancreatitis, or a personal or family history of medullary thyroid cancer, or a disorder called multiple endocrine neoplasia. If you have diabetes and take other medications to help control your blood sugar, your provider will want to monitor your blood sugar closely and may reduce the dose of your other diabetes medications while you are taking these medications. Tirzepatide brand name Zepbound is a dual-acting GLP-1 and GIP receptor agonist. It is injected once a week. Tirzepatide may be the most effective medication for helping people lose weight. In studies, most people taking tirzepatide lost at least 5% of their body weight, and the average weight loss was 21%. Semaglutide and liraglutide are GLP-1 receptor agonists. Studies suggest that they have cardiovascular benefits in people with diabetes. Semaglutide has also been found to have cardiovascular benefits in people without diabetes. Liraglutide brand name Saxenda is injected once daily, while semaglutide brand name Wegovy is injected once weekly. The doses of these medications that are most effective for weight loss are higher than those used to treat diabetes. Other medications in general. The incretin-based therapies are usually recommended first for people who are candidates for weight loss medication. However, other options are available for people who cannot or choose not to take these medications. Phentermine topiramate and extended release topiramate are available in combination as a single capsule brand name Cymia. Topiramate is used for the prevention of migraine headaches and to treat seizures in people with epilepsy. People taking topiramate for these indications lose weight, but the way this works is uncertain. People taking this combination medication lose approximately 8 to 10% of their initial body weight after 1 year. The dose of phentermine topiramate is usually increased gradually, while weight loss is monitored. If you do not lose 5% of your initial body weight after 12 weeks on the highest dose, phentermine topiramate should be discontinued gradually, as abrupt withdrawal of topiramate can cause seizures. The most common side events are dry mouth, constipation, and a pins and needles sensation of the skin. There is also a risk of psychiatric and cognitive problems. This risk increases with larger doses of the medication. Although phentermine topiramate improves blood pressure slightly, it is also associated with an increase in heart rate. Phentermine topiramate should not be used during pregnancy because of the risk of birth defects. People who could get pregnant should take a pregnancy test before starting this medication and monthly thereafter to ensure that they are not pregnant. It should also not be used in people with cardiovascular disease, high blood pressure, or coronary heart disease. Naltrexone bupropion is a medicine that is used to treat depression and to prevent weight gain in people who are trying to quit smoking. Naltrexone is a drug used to treat alcohol and drug dependence. People taking combination naltrexone bupropion brand Name Contrave lost approximately 5 to 6% of their initial body weight after 1 year. Common side effects include nausea, headache, constipation, insomnia, vomiting, dizziness, and dry mouth. The dose of naltrexone bupropion is increased gradually over 4 weeks. If you do not lose at least 5% of your initial body weight after 12 weeks, the medication should be discontinued because benefit is unlikely. Naltrexone bupropion should not be used in people with uncontrolled high blood pressure, a seizure disorder, or an eating disorder. It should also not be used by people who take or have recently taken certain other medications, including those containing bupropion, chronic opioids, or monoamine oxidase inhibitors. Orlistat or listed brand name Xenical is a medicine that reduces the amount of fat your body absorbs from the foods you eat. A lower dose version, brand name Ali, is available without a prescription in many countries, including the United States. The recommended dose of the prescription version is 1 capsule 3 times per day taken with a meal. You can skip a dose if you skip a meal or if the meal contains no fat. After 1 year of treatment with Orlistat combined with lifestyle changes, the average weight loss is approximately 8 to 10% of initial body weight. Cholesterol levels often improve and blood pressure sometimes falls. In people with diabetes, Orlistat may help control blood sugar levels. Side effects may include stomach cramps, gas, diarrhea, leakage of stool, or oily stools. These problems are more likely when you take Orlistat with a high-fat meal. If more than 30% of calories in the meal are from fat, side effects usually improve as you learn to avoid high-fat foods. Severe liver injury has been reported rarely in people taking Orlistat, but it is not known if Orlistat caused the liver problems. Phentermine is a medicine that reduces food intake by causing you to feel full more quickly after eating. Phentermine is classified as a controlled substance by the United States Food and Drug Administration due to its potential for abuse. Although the actual observed rate of abuse is extremely low, it is the most widely prescribed single-agent weight loss drug in the US. In trials ranging from 12 to 36 weeks, patients taking Phentermine lost an average of approximately 15 to 17 pounds, 7 to 8 kilograms. Phentermine may cause an increase in blood pressure and heart rate. Your healthcare provider will monitor you for these side effects while you are taking the medication. In addition, Phentermine may cause insomnia, dry mouth, constipation, and nervousness. You should not take Phentermine if you have heart disease, uncontrolled high blood pressure, hyperthyroidism, or a history of drug abuse.